What do you think of Venice Symposium?
So it's a great congress for us. So I'm a young surgeon who is interested in venous disorders. So there are lots of pioneers in the industry, our surgeons that we look upon. So they share their expertise, they share their knowledge. So it's a great opportunity for us. So I thank the organizers for this congress a lot.
What do you think are the most interesting aspects of this meeting?
So I think the most interesting aspect is to see the knowledge and the expertise of our pioneers hand-on and they are from their mouth, I think. So there are lots of professors, there are lots of very experienced colleagues in this congress. So we can see all of their knowledge from other countries, from UK, from Italy, from lots of other places from Europe. So I think it's the most interesting and the opportunistic way for me to see their expertise.
What suggestions would you like to provide to the organizers for next year?
So I think there could be more workshops, I think. For example, maybe live cases for to see us on hands-on patients. It's enough, but maybe more workshops would be better next year.
Would you recommend your colleagues to join us next week?
Of course, because as I mentioned earlier, I'm a young surgeon who is interested in venous disorders. So if any surgeon, any doctor who is interested in varices, varicose vein treatment and venous disorders, I recommend them to come here next year or the other years to fulfill their knowledge, to improve their experience. So it will help them a lot in their daily practice.
As you know, the world of biology is constantly evolving. So, in your opinion, what are the areas in which the greatest changes are being observed?
So, first of all, I'm a cardiovascular surgeon. So, as most of the cases, so it evolves from being an open surgical treatment to becoming an endovenous endosurgical treatment. So, we are, as surgeons, vascular surgeons, we are learning to use ultrasound imaging, and we are using new techniques to become a minimal invasive about it. So 30 years, 20 years ago, there will only come open surgical treatment methods, and now we don't use them. So as the years passing and new developments are occurring, I think it will only be about endovenous treatments, minimal invasive. So there will not be a lot of open surgical treatments in the next years.
Thank you so much for your time.
Thank you.